Hi, in this video, I'll be talking about skin discoloration that occurs with breast cancer and its treatment. Skin discoloration is a common side effect of radiation therapy in particular. So I'll start with radiation. Radiation goes directly to the area where it's directed, and you might notice some sort of a sunburn of the skin, and the skin can even take on hyperpigmentation. It can become darker for quite a bit of time after treatment. This will resolve over time. I can almost promise it. And the way you can tell that it's from radiation is it'll actually have a shape to it, like a box. If you get radiation to your spine, the same thing. You'll notice a square of discoloration where the radiation's being given. If you're getting radiated to the back, you can even see discoloration on the front of your body. So if you see areas that are in line with the radiation, but not directly where you think you're getting radiated, don't be alarmed. We see that the energy goes through the skin. Chemotherapy, I'll cover next, and then I'll go to surgery. Chemotherapy can also cause a very distinct pattern of skin discoloration. First of all, I'm going to mention something called radiation recall. If you have radiation and then later get chemotherapy with a taxane, like in particular paclitaxel or docetaxel, the area that got radiated before can actually sort of heat up again. It doesn't get temperature hot, but the color discoloration, for example, in the chest will come back. That will fade as you get away from the chemotherapy. But that's a funny reaction that we often forget to tell people about. Chemotherapy's discoloration without this radiation recall occurs in the palms, in the soles, in the nail beds, and in the mucous membranes, so the mouth in particular. And there can be actually quite dark patches of discoloration on the tongue or the palate or inside the cheeks. On the fingernails, the nail beds can start to look even black. If you have darker skin, you'll notice that. People who have more pigmented skin, people of Mediterranean descent, for example, Black people with chemotherapy can get this darkening of the nail beds. It can be quite alarming, but it's normal and it will return to normal. Your nail beds will go back to normal. Your mouth will go back to normal. That I can tell you I've seen over and over again, but it's important to know it's normal. A lot of folks will put nail polish on their fingernails. The discoloration on the palms will show up as spots, and that will also fade. So normal, upsetting, it'll go away. Surgery can cause discoloration because we're cutting through the skin and other tissues, so you'll have some bruising and redness and tenderness after surgery. In general, that should get just better over time. As time passes, that should resolve. If you have an area after surgery that looks pink, that gets warm, that's tender, you should be seen by your medical team because that could be a sign of infection in the surgical area or sometimes a reaction to the tape or the dressing that was put on your surgical sites. That's not uncommon at all. And you'll notice it's in the area of the tape or the adhesive or the dressing. And this is very easily managed by switching to a different dressing. In terms of managing discoloration, there's not a lot you can do other than let the tincture of time help things heal. But what I do recommend during chemotherapy and radiation therapy is that you use sunscreen, that you cover up the skin and wear loose clothing. One thing we've seen is in people getting chemotherapy that causes pigmentation of the hands and the mouth, nail beds, is you can also see it in areas where there are areas of pressure. So around your waistband, there's a medication called liposomal doxorubicin that can cause that. And wearing loose clothing, like even boxer briefs, can help with that. I've had patients where their partners boxer shorts so that they don't get that waistband pressure. If you see discoloration in other parts of your body that haven't been radiated or that I haven't mentioned, it's important to bring that to the attention of your medical team. So if you have easy bruising, or if you see spots on areas of pressure or the lower parts of the legs, that could indicate a problem with platelets, which are clotting cells in the body, and we see that with chemotherapy. It can also occur for completely unrelated reasons, and it's important you get medical attention. If you want to learn more about the medications that you might be offered as part of your treatment plan, visit Yerbba.com if you want to learn more. And if this video has been helpful, click like and subscribe so that helps other people going through the same thing you are find this video.